What are these pictures of animals doing here?
We thought you might like them.
Yeah? Do you want a picture of my hands? Undoing my starburst?
Yes.
I've been exploring a career in art therapy. My interest was first piqued when I thought of doing art therapy working with children. I'm a mother artist, and I thought it would be a natural path for me, as I'm drawn to psychology and I'm a visual artist. I was fortunate enough to gain a co-op position at the Dr. Peter Center this fall through Emily Carr. The Dr. Peter Center is a center for people with HIV and AIDS, and I've been working in the art studio with the resident art therapist there. And the experiences that I'm gaining there have
What are you doing?
been more of the techniques of a counselor than visual artist.
Oh, a little detoxing program. I'm trying to clean myself out so I can find out where I'm at medically.
Yep.
A little drug holiday.
Art therapists take on a role of a listener rather than explainer, which contradicts what we're taught to do, especially at Emily Carr, where the habits of praise and criticism in critiques are ingrained in us.
You can, but I'm still trying to figure out if I want to fasten that in the center.
Oh, interesting. I found the practice of dialoguing about feelings while being neutral about the art is very challenging. It's instinctual to want the participant to feel good about what they are making. You are one creative...
Jack-o'-lantern.
Yeah. One technique that I've been learning there is active listening and responding, letting the artwork speak through itself instead of the artist. It's close to the free association techniques of early psychoanalysis. Instead of talking through the ego, the artist talks with paintings. It gives voice to the art instead of the participant talking about how they feel. They animate the painting and talk through its voice.
Is that your son? No, I don't know.
The reason for this is that it takes the pressure off the patient and gives the artwork the power to tell a story about the emotions that made it. What do the cows relate to?
Spiritual.
Spiritual. The sacred cow.
Honey, my cows are my cows.
Don't put meaning on my cows. The biggest challenge I've faced so far are issues of boundaries. I really didn't realize before how important they were. I think as people, we have an instinct to want to make other people feel good and don't protect ourselves sometimes. If you have weak boundaries, you can get lost in other people's territory. If you have holes or gaps in your boundaries, we're vulnerable to invasion. If you have borders too thick, then people can't get close to you. What I've noticed is that I may have a few holes or gaps in my boundaries.
I was supposed to go to court this morning. And,
The situation where I'm working in now, I've had a few encounters with people where I haven't known how to walk away when it was time and protect myself after a monologue of 45 minutes, not knowing how or when to shut that down.
if you could fax the doctor for me and tell him that I'm sick, and then maybe we need to phone the court, and we need to, I think maybe Burnaby, I'm not sure, Burnaby Court, maybe Main Street Court, and maybe...
Good to you.
You did good. You did really good.
But I mean, that person would keep going on.
Yes.
So I'm thinking in my mind, okay, who here could help with this?
Okay. Oh, yeah.
I asked Caroline if we could practice that and do some role playing.
I had to prep probably 200 tomatoes, this big box of tomatoes, and just, racing the clock, looking up while I'm cutting these tomatoes, and then, and then the meats, we had frozen burgers, and we had to start serving them in half an hour.
Wow, it
and
sounds
then,
like you've had a lot of stuff.
not only the burgers, but we had to get salad dressings made, and
You know
people
what?
were already starting to come in.
You know what, Claire? You're here now. You're not at work. So maybe you could take this time to just
It's so
try and relax a little bit and use the center. Maybe we could go to the art studio, or maybe you just feel like having a cup of tea in the
hard.
cafe.
Yeah, it's hard though, just not thinking about
You know
work.
what?
It's
I'm on
just-
my way down to the cafeteria right now. I'm gonna get some lunch, and maybe you just want to have a bite
Oh,
or
I
some
can't
tea.
even think about food. It's all I do all day. I
Oh,
just work
really?
with food all the time.
You know what?
Just-
I'm thinking about food because I'm really hungry and I need to go eat.
Oh, I
But
couldn't
it's
eat
been
right now.
great
I
talking to
couldn't
you.
eat. I couldn't even look at food.
Try
right
and
now.
relax. Try and use this time today to be away from work. I'm just gonna go get some lunch, and maybe I'll see you later in the day.
Maybe if I'm still
Okay.
around.
Claire, the longest time because of
Wait.
tomatoes and that's
Sorry, yeah, it's hard.
Another aspect of art therapy is creating a safe space for the participants involved. The art therapist may not be actively teaching or interacting with a patient, but the art therapist's presence gives a safe energy to the studio or where you're working. It's important to be aware of everyone in the studio and not just the person who you're working with, for everybody's safety and comfort level. That's something that I'm always aware of in the studio.
And then I could get little pieces of doweling.
There are people that really like a lot of attention and even like collaborating on pieces, and then there are other people that need a really quiet, safe space to do their thing, and they don't necessarily want anyone talking to them. You've got to make it a space where everyone can participate there. Non-judgment is the biggest thing that someone needs to possess in working in a setting like I'm doing now. Non-judgment about the art and about the person. All of the people that I've been working with have had past trauma. Many of them are homeless, drug addicted, and have mental health problems. They may come to the studio with a lot of art experience or may feel really intimidated and fearful of making art. Many participants may feel that they'll be ridiculed and that there will be judgment and a fear of really exposing themselves and their emotions or their past trauma. It's essential to remain neutral about the work at all times. So instead of the praise-criticism behavior, the therapist will always refer to the artist's opinion of her work. This, again, is another really tricky thing because you want to make someone feel good about themselves, especially if they have low self-esteem. And finding the phrases, the techniques to use to be neutral is something that I'm still learning every time I catch myself praising.
Thanks.
Boy, that flower piece turned out well, Robert.
Yeah, you like it?
Mm-hmm. The reason to be neutral is because it aids the participant in gaining inner trust and not to rely on the expert to evaluate the art. Some people will often ask, do you like it, for instance? And this is a great time to throw that question back to the artist. Say, well, how do you feel about it? And to get that to be instinctual is my goal.
Creativity is supposed to come in there. And then environmental, that's what that is. And social. And this starts to move into the physical. And then I'm going to do the emotional, and this is spiritual. And there's the intellectual.
Another reason that I'm so drawn to art therapy is that it coincides with my belief system and the things that I'm interested in, as well as the psychology of it. It's a well-known mind-body intervention, such as meditation, visualization, prayer, and psychotherapy. It's got a nice sound, eh?
Yeah, it's really deep.
Art making is widely recognized for its deep connection to mind, body, and spirit. It's something that I feel when I make my art, and one of the reasons that I make my art. If I can bring that to someone else, it's really, really rewarding for me. The work of the art therapist is to make someone feel healed rather than cured. This point is reinforced every time I work with the participants at Dr. Peter. One strives to help people reach a point of psychological or spiritual well-being through art therapy. I find connections to art therapy and my practice of yoga. When doing yoga, the challenge is to be a witness of your own thoughts and the sensations in your body without judgment. Art therapists must practice noticing rather than analyzing, and I'm learning the great difference between discernment versus judgment, which I practice both in yoga and participating in someone else's journey with art.